Good evening. This is Dr. John Bennett broadcasting from Miami for InternetMedicine.com. Tonight in the Rheumatology studio, we have the pleasure of having Farhan Tahir, MD. He's a board-certified rheumatologist from Philadelphia, and he's going to be discussing 3 different articles, the latest news in rheumatology. So I'll let him take it from here. Good evening.
Hi, John. How are you? It's
Very
pleasure
good.
to be with you today.
Very good.
So, John, I was going to talk a little bit about fibromyalgia and when it overlaps with rheumatoid arthritis. A lot of patients would be finding out that when they have rheumatoid arthritis, they become more sensitive to pain. And this condition, a hypersensitivity to pain, is called fibromyalgia or central sensitivity syndrome. It is known to rheumatology community that rheumatoid arthritis itself is a disease with many debilitating problems. But on top of it, if a patient also has fibromyalgia, it's actually a double whammy. They get to have significant impact on their quality of life. And the results are poor outcomes in how they enjoy life, how they are functioning in their life. And I chose these 3 articles which go over what happens to patients who have rheumatoid arthritis, what happens to patients who have rheumatoid and fibromyalgia, and how it affects them. So if you don't mind sharing the slide with us, the first slide.
Okay, let me just put it up here. Okay, just let me know when you want to change.
Sure.
Okay.
So our main focus today is going to be fibromyalgia impact on rheumatoid arthritis. So next slide. So this article was published in Annals of Rheumatic Disease, and they looked at persons with chronic widespread pain experience excess mortality, longitudinal results from a UK biobank and meta-analysis study. So what this study was doing is looking at patients who have chronic widespread pain. And they found out that this chronic widespread pain is related to excess mortality. Lifestyle changes are actually at the bottom of foundation of this poor life quality and excessive mortality in these patients. This UK study was done, has a patient cohort of about 0.5 or half million patients throughout Great Britain, and they have patients between ages of 40 and 69 years of age. The study was started in 2006 and was completed in 2010. An objective of the study was to see, do patients who have chronic widespread pain, do they have premature mortality? There were about 7,000 patients enrolled into the study, and they reported chronic widespread pain. They found out that these patients experience excess mortality up to 2.5 times than people who do not have chronic widespread pain. These patients also have higher risk of cancer, cardiovascular disease, and respiratory complications. At the end of the study, they analyzed and they wanted to look for what is the common factor that combines this chronic widespread pain and poor mortality. Excess mortality and poor quality of life. They found out low levels of physical activity, high body mass index, poor quality of diet, and smoking. These were the 4 major factors that were contributing to this excess mortality. And if you look at it, now we see enough evidence that all of it seems the right and plausible reasons, because most patients who have fibromyalgia, they tend not to be active. And that leads to poor outcomes. They become obese, cardiovascular diseases, metabolic syndrome, and as a result, short lifespan. High body mass index is also similar in the same situation. So this study said that now there is a clear evidence that persons with chronic widespread pain have excess mortality, and this study says that lifestyle is the major contributor here. We should now, with this enough evidence, should actually make a priority to talk to patients about their lifestyle and also their how can we engage them in physical activity, how can we give them diet advice, how we can give them structured exercise advice. All of this would be helpful for our patients, because we will be able to reduce their complications, obesity rate, and will help them to live not only better quality productive life, but also increase their lifespan. And I think this is a really good study. I really liked it, that it brought home great message of advising patients to get up and move, reduce obesity, improve quality of diet, educate them about that, and counsel patients about for quitting smoking. So I think that was the key point taking home. So next we can go to the second article, which is about fibromyalgia predicts 2-year changes in functional status in rheumatoid arthritis patients. Yeah, you got it. This is the screen I wanted to show. So this article was published in Arthritis Care and Research. We are looking at fibromyalgia and its effect on rheumatoid arthritis patient over 2 years. Now, rheumatoid arthritis patients with fibromyalgia have higher disease activity. They have greater medical costs and worse quality of life compared to patients who have rheumatoid arthritis and do not have fibromyalgia. Now, there's not been a study that looked at it over a short span of time, and this was the only study that looked at it over 2 years. So these are almost brand new patients who got diagnosed with rheumatoid arthritis, but also had fibromyalgia. The purpose of the study was to determine the impact of fibromyalgia on 2-year changes in functional status. And John, you can move to the next slide so that I can move along to the same way. Yeah. So in this study, they looked at the impact of fibromyalgia for 2-year changes in functional status of RA patients. And this study was done up in Boston, in Brigham and Women's Institute. They're doing a study called Brigham's Rheumatoid Arthritis Sequential Study, and they enrolled patients in a subset of patients who had pain, and they wanted to look at the effect of pain on rheumatoid arthritis. Next slide. You will see that that they included 56 patients who had rheumatoid arthritis. About 16.7 of them had fibromyalgia, while about 83% did not have it. They checked the patient for the scales that we check in our clinics called Modified HAQ score or MDHAQ score. They were matched for disease duration, rheumatoid factor, CCP antibodies, and seropositivity, as well as disease activity. They were checked for psychological distress and also other things such as polysymptomatic distress scales. All of this was done on a semi-annual basis. So they found out that patients, next slide, John, the patients who had fibromyalgia had about 14% higher risk of having poor impact or higher disease activity. So if somebody has rheumatoid arthritis and fibromyalgia, they need to be watched more closely because most likely they will have poor outcomes. Fibromyalgia patients had increased number of comorbid markers shown up on their disease activity. One of them was called Modified HAQ score. It had about 4 to 7-fold higher than typical changes seen in normal rheumatoid arthritis patients. So the end result is that RA patients who have fibromyalgia, they will have high disease activity of rheumatoid arthritis. They would have greater medical costs and worse quality of life compared to RA patients without fibromyalgia. This was another important study that showed that patients who have fibromyalgia and RA are at a higher risk. And we have now, in just recent study, we talked about how can we improve life on those patients. We need to educate them on not only giving them medicines, but improving their lifestyle, avoiding obesity, educating them on diet and lifestyle. So I think this was the third study that brought us some, second study that brought us some important information on this topic. We can move on to our third study, which is about exercise. And I like this study because, in our practices, we tell patients go and exercise. But what exercise the patients should do? Patients are afraid to do exercise when they have rheumatoid arthritis and fibromyalgia. So I have started incorporating lifestyle and medical fitness in my practice. I work with closely with fitness instructors, lifestyle coaches that can help patients exercise in closely monitored fashion so that I am aware that how they're performing. And we have actually started incorporating telemedicine so that I can visualize how they're doing exercises with their personal trainers and our fitness instructors. So when I saw this exercise, I was really happy to see this study on exercise. So this study looked at resistance exercises improves physical fatigue in women with fibromyalgia. And it was a randomized control trial. So if we go to the next slide, you would see that what they did was they looked at person-centered progressive resistance exercise programs. They individualized resistance bands on patients and make them do exercise. They enrolled about 130 women who were in mid-age group, and they were blinded, randomized, controlled, multi-center trial. So it meets the criteria for how to do exercises and blind them so that the assessor doesn't really know how much are they doing a resistance exercise or not. So in the next slide, you will see that these patients were met with their trainers twice a week for about 15 weeks, and outcomes were measured based on assessment of fatigue levels. They had a multi-dimensional fatigue inventory, and they found out that there was a higher improvement in patients who had treatment given to them based on their resistance exercise group. So if you can find and identify patients and hook them up with clinical fitness instructors, it could make an impact on patient outcomes. Female patients benefited from being involved in the treatment planning. And sometimes that's what we need to do for our patients. If we get them involved in physical activity, I think it makes a huge difference. And if they know that they are working with a fitness instructor that has clinical knowledge about their disease, it would help them even more. And supervised that on top of it with their rheumatologist would be even better. And with this technology in our age now, we should incorporate telemedicine. And even if patients are at their home, I can set up a meeting with them with a personal trainer, and they can train them even at home. And we can get that made sure that they're doing their exercises twice a week. So I have certain printouts that I give to patients to do exercises, including stretching exercises. We have also incorporated a whole protocol for lifestyle medicine within our practice so that we can help patients. So if you go to the next slide, John, you would see that one of the things that exercise programs helped them the best was improving the sleep efficiency. And you know how sleep is important. Poor sleep is linked to obesity. It's linked to cardiovascular disease. It is linked to inflammation. How can we improve sleep? Most patients would think, oh, giving them Ambien would make a difference, or taking some medication. I think introducing resistance exercise in patients with fibromyalgia would improve their sleep. And you will not only make them stronger, make them feel better, their fatigue will be better, their sleep will be better. So I think exercise goes a long way here. So this study also showed that if fibromyalgia patients tend to have significant amount of pain, having to do some changes in their day hours, like their work day hours, to make the shorter hours also improved. And I think initially I see patients, I tell them, rather than going for full disability, I think if you reduce your hours, maybe you put in a nap in between your work, would help you recover better. And if we combine it with some exercise regimen right there, I think it would make a huge difference. So the improving sleep and exercise, resistant exercise, was a significantly important factor in these patients. So I think with the help of these slides, I was able to go through a little bit faster than these articles. So I think we can open up the panel for discussion here. I'm done with my slides. I could share with you a little bit some more thought process I have here about role of, you know, fibromyalgia and how poor diet can impact, and high dense food, which, like, if you look at a food by weight, how much does it weigh and how much calories it is, if it is a high density food, it will lead to high mortality, and patients with fibromyalgia tend to go for these kind of diet which are actually not healthy for them. So I think counseling on their diet is important, and giving them some resources that they can modify their diet, they can modify their lifestyle, goes a long way. So
very good. Very good. I have a couple of comments and questions, Doctor. You know, I'm probably like most physicians. I really don't know much about general physician. I don't know much about fibromyalgia. Could you please give a brief discussion of what it is and also how it's diagnosed? Is it a laboratory diagnosis or clinical symptom diagnosis?
Great question, John. I think that's a great question. So fibromyalgia is a condition where patients tend to develop diffuse pain in their body, and it is related to hypersensitivity of their brain to process pain stimulus. Imagine if a patient has a very low amplitude to feel pain, a hug or a small impact on their body would create a high intensity pain. And that is because the nerve fibers are actually connected to our brain center in the brain and convey the message so rapidly in a high amplitude fashion that there's a constant awareness of pain. Now, pain is not the only component that we see in fibromyalgia. There's also poor sleep and constant fatigue that are main factors that also affect the quality of life in patients with fibromyalgia. Most patients who tend to be autoimmune disease patients, they have higher incidence of fibromyalgia. There's some studies that said that almost 18% of autoimmune disease patients also have an overlap of fibromyalgia. And as we just discussed earlier, it is quite debilitating. Now, your second question was, is there a blood test? I wish there was a one, because we would be able to screen them. Right now, there is none, but we have clinical criteria for diagnosing fibromyalgia. And American College of Rheumatology comes up with the recommendations to get the history, asking the patient if they have multiple areas of pain over their body on all four quadrants that are reproducible with small amount of pain and tenderness. They are accompanied with constant awareness of pain, fatigue, poor sleep, lack of concentration. They constitute fibromyalgia. So there are some patients who you would see low levels of vitamin D and these symptoms. I tend to treat vitamin D aggressively in those patients because I consider that as a marker to indicate that high pain in this patient could be related to low vitamin D deficiency. But there's no specific test that I could tell you that can confirm diagnosis of fibromyalgia.
Well, you know, I've had experience talking to some fibromyalgia patients, and generally they tell me stories about how long it took to be diagnosed. That's a common thing, correct?
Yeah, because most of the patients, when they come to the doctor's office, they have a very non-specific complaint. It could be, my muscles hurt, I can't sleep well, I am not able to concentrate. It's very hard to judge without a blood test until and unless you have high suspicion for it. I think that there's been a great deal of awareness, but at some of my senior teachers during my residency used to tell me that it was used to be called a middle-aged woman's disease where they complain too much. But now we have developed awareness that it's actually high amplitude of pain and low threshold for pain, and it's constant awareness that makes them feel that way. The study that we just talked about, it affects multidimensional quality of life, and most patients are not only have joint pains, they also have muscle pain. That's why it's called fibromyalgia. Myalgia meaning the pain in the muscles.
When you examine someone with fibromyalgia, is there something you watch for to cinch the diagnosis? What do you do on a physical exam?
Yeah, so I try to ask patients, about their quality of life. First, I try to ask them if the pain is all over the body. So I would ask, I have a questionnaire that helps me find out that, number one, what are the areas of their quality of life that they are not comfortable with, and it is something that goes over with. I might be able to share that questionnaire with you if you bear with me.
Okay, sure.
I'll look it up for you, and I'm going to share that with you because I think it's useful if I go over with you. So let me share the screen with you in a moment. Okay, so
it's a questionnaire for potential fibromyalgia patients.
Yeah, potential fibromyalgia patients. So here it is. Are you able to see it?
Yes.
Okay, so as you see it, it's a multi-dimensional health assessment questionnaire. So I asked the patient this: over the last week, what activities were you able to do and not able to do? And as you can see, it's going over, are you able to dress yourself, getting out of the bed, holding a cup of glass, outdoor activities, what things you do. And I score it over here, and it gives me their functional status. Then I go to the next question: how much pain have you had because of your condition over the past 1 week? And they tell me how much score it is. And as you can see, it goes from 0, where no pain, to 10, where is the maximum amount of pain. And then we score them on a pain scale. Then I go down and I ask them about their joints. Now, this is what helps me differentiate how much it is rheumatoid arthritis or fibromyalgia. Because most patients with fibromyalgia, they will either circle everything, or they would say that it is in their neck and back and not the joints. Right. So it can help you to assess what areas are mostly affected. My next question is usually how they feel about their own disease. It's almost like patients' global assessment of their own disease, and they can tell me if they're feeling very poorly versus very well. Now, in the next page, as I'm scrolling, you can see it talks about review of system. Most patients who have fibromyalgia, they would say yes to many questions. If you see on the right side corner, you would see back pain, neck pain, depression, anxiety, problem with thinking, memory over here. And this is very common in fibromyalgia. If you do not have a patient with rheumatoid arthritis overlapping fibromyalgia, you won't see those symptoms. You would see primarily it's all about fatigue and joint pain and swelling. So that helps me assess where they are. The next one is about how do they feel in the morning? Do they feel stiff in the morning? And that is a marker for inflammation in the body, but this is more commonly seen in rheumatoid arthritis patients. In the next question, I would ask them how you feel compared to the last week, and what exercises are you able to do, and how often do you do it. This way, I would be able to assess if they are inactive, if they are sedentary, or they have some activity. And based on that, I could hook them up with a fitness instructor that could motivate them to be more active to the next level. I can also assess their fatigue here. In the fatigue, it's important, as we just were talking in our last article about impact of fatigue in patients with fibromyalgia improves with the resistance exercises. So we try to see if we can improve the resistance, the fatigue with resistance exercise. So I use this as a marker to follow them along. And with this, I am able to pretty much assess the patient on every visit, compare them in a graph form to see where they are. So I'm gonna switch back to our screen. Are you able to?
Yes.
To
Okay.
see
You're
me?
off. Yeah, you're off the screen
Okay.
now. Okay.
All right. So that was my day-to-day form that I use for patients to assess function, and it gives an objective way. Sometimes I send patients home with this, and believe it or not, I've also started talking to patients about impact of meditation. That helps with deep breathing exercises, and meditation helps with dealing with the anxiety and the stress and the pain seen in patients with fibromyalgia.
Mm-hmm. You know, you mentioned, Doctor, a couple of the discussions about exercise. Do you prescribe a certain type of exercise, or you just say generally just exercise?
No, I prescribe a certain type of exercise
Okay.
based on each patient's individual baseline. So I have pretty much about 6 levels of exercises that I prescribe to them. And then I have the personal trainer work on those exercises and tell me the progress on it. But it's very specific based on each individual's body weight, their other health status. So I would measure their waist circumference, their hip circumference, body mass index, body fat index. I would also assess their ability to perform activities in the what is their current level of spinal status? Are they able to stand all the way straight? What is their ability to flex their spine? What is their ability to balance themselves? So they go through an hour-long assessment of their physical function before we put them to an exercise plan.
Okay.
But
I was going to ask you that. If you have them see the therapist before you prescribe the exercise program.
Exactly. Yeah, we do that, and most of our staff is able to assess that for our patients, and then we'll create that for them. Mm-hmm. And I check their performance in about 3 months. Every 2 weeks, I get a report on them, and then we share some information and try to improve their outcomes. So it's been helpful utilizing all those resources to focus on fibromyalgia patients.
Very good. You made a reference to using telemedicine to work with a therapist, I believe. And patient. Could you talk a little bit about that?
Yeah, so I've been interested in use of technology and helping patients. So if I were to share with you my website, let me go there. I have linked to telemedicine where I could talk to patients when we enroll them on our exercise. Our therapist can go online, use that link, and talk to the patients in their home, in their offices, and use that. So I'm going to share my screen with you. I'll be able to share with you so this is our website. Here you are able to see how we assess and connect. So telehealth, this link takes the patient to, we ask them to create an account, and they would go ahead and when they're online and doing a meeting with me or with the patient, they will be able to go online and talk to us. So they go on, they join a meeting with me or my staff, and this is, as you can see, the screen opened up, and patient would be able to come and do it. And I share my schedule with them based on how they are able to come and meet me, or they would have the schedule with a fitness instructor, and they'll be able to do it. We give them all that information before the first visit. They would come and do it. They would come and talk to us, get assessed, get their lifestyle data populated, exercise, nutrition, all of that gets created for an individual patient based on their needs, and then we will just talk to them. So it's been great help. I enjoy using technology in my daily practice. It helps and improves outcomes and reduces cost of healthcare.
Yeah, I imagine the patients must like it.
Yeah, they like it and they find it useful, because most of the times, if they are coming, if they want to learn something about the exercise and the nutrition, rather than be waiting for 3 months to find it out. We can do it. We definitely find it providing great value to our patients, and we've seen great results.
Okay, so you got some positive feedback from the patient community on using that technology.
And I also use now wearable devices that I can, and our fitness instructor team and the whole fitness team can also see how many steps they're doing. We are incorporating monitoring of blood pressure, and for diabetic patients or patients who are obese, we can monitor also their scales for body mass index and also blood glucose levels. Well, so we're incorporating all that technology.
Yeah, you mentioned with a, go ahead. I'm sorry.
Sorry. Well, I'm in the process of helping create an app to do that even more concise, all of it in one place.
What, assessing the lifestyle of the patient?
Yeah, lifestyle, and also doing all of this. So right now we have two different systems that we are doing it, the telemedicine and monitoring of the health data, but all would be combined in one app.
Okay, very good.
Is
diet included in that app too?
Yeah. So we are working with a great group of dietitians and companies that actually create personal diet plans as well. I'm hoping that soon I'll be able to link with some companies who could prepare meals for patients and maybe also get them shipped to the patients on a weekly or twice weekly basis, so that they can get the right meals delivered to them if they don't have enough time or energy to create for them. But that's a work in progress.
Well, I really think a doctor needs to be specific as far as instructions on diet and exercise, because I myself as a patient was seeing a cardiologist and he said to me, lose weight. And then he left the room. And I was like, well, yeah, but how? How? Yeah. What about, because, I'm just like the next patient. If I don't have a plan or some advice, it's harder for me to do that.
Yeah, so there are companies that I'm talking to that could either working to get the meal plans shipped to them, either cooked or semi-cooked form, or in a form that they can be put together in a short span of time, but they would be purely based on patients' requirements on our health data assessment that we create for them, and we'll reassess them every 3 months and make changes as we need to. So we kind of making it totally personalized, but very specific and goal-oriented.
Mm-hmm. Very good. Very good. Okay, Farhan, very good. Good discussion. Good discussion. Thank you very much for taking the time to meet. And this technology, I think, is going to get better. I look forward to hearing about any particular date of the app will be done.
We will any
target date.
We'll be releasing it at the start of next year, 2018. I think we'll give people a reason to live healthy and combine it with their New Year's resolution.
Yeah, and have a plan. Have a concrete plan.
Yeah, we'll start setting up soon enough, but it would be fully work and functional. So.
Okay, very good, Doc, and we'll see you next Thursday at 7 o'clock.
All right, very good. Thank you, John.
Thank you.
Be well. Take care.